For a woman, losing your hair can be emotionally devastating and embarrassing. In fact, 1 in 4 women have female pattern baldness or thinning hair.
Yeah, but there are treatments available now that you can shower, exercise, you can do all those things, or walk in the wind even without worrying about your hair. And here to tell us more about this low level, it's a laser therapy, is John Laudoff with Transitions of Wisconsin, along with Marianne Banco. She is a very happy client. Hi, guys.
Good to see you both.
Good
It's
morning.
great to see you. And I think this is very exciting because would you agree that losing hair loss and thinning hair is something that really affects your self-esteem?
Oh my gosh, absolutely. I think, and not just with women today, but men as well.
Yeah.
You know, I always say that if you're having a bad hair day, your whole day is ruined.
Yeah,
Right?
yeah.
So it's important.
Yeah.
Yeah, and really, you know, to Molly's point, you know, that self-confidence, even with men, you know, a lot of men don't want to shave their head because maybe they don't feel like they would look the best bald. And so there's other options out there for men and women, but I think when it comes to females, sometimes that's even more connected to our identity.
Right.
How did you get to the point of saying, you know, I think I need to look into hair therapy?
Well, it's interesting. It actually started 10 years ago. Okay, I noticed that my hair was falling out more than normal. And I really try to take care of myself. So as a result of that, I'm very cognizant of changes in my body.
Yeah.
And the other thing I noticed was that the texture was changing. You know, it was getting coarser, it was dull, and it just didn't look healthy. And I completely understand seasonal shedding and, you know, the impact that hormonal changes and stress have on you. And I was going through a lot of both of those at the time. But what really, really threw me over the edge is I was driving one day. Okay, I have a sunroof. It was open. It was a beautiful sunny day. And I glanced up in my rearview mirror and I freaked. Okay, I could see my scalp. You know, my hair was that thin. Okay, so I did the most taboo thing that anyone could do. I went home and I started looking at pictures from 25, 30 years ago.
Yeah.
Not
idea.
recommended.
It's like, don't
bad
do that to
idea,
yourself.
Bad idea, because we're never going to look like that. But it really brought to light of, you know, how out of condition my hair was.
Yeah.
All right. So I try to live a very natural, holistic life. I'm not one to run to a doctor and go on medications. So as a result of that, and I love to research, I jumped on the internet, which we know is overwhelming. Well, everybody's product is perfect. Everybody's product is going to make your hair strong and grow back and all this good stuff. Well, I started trying different topical solutions. And I was taking all these different supplements. Well, we all know that with hair growth, you know, it takes, what, 3 to 6 months before you see an impact. In the interim, my hair is falling out. So fortunately, and I literally stumbled across Transitions website. Okay, so I made an appointment to come in and see John for a consultation.
All true so far, John?
All true.
All right. All right, go
Not
ahead.
making this up. Not making, he didn't pay me too much.
Too much.
So anyway, I came in for a consultation, and he did an analysis of my scalp. And, you know, it was great. He said, Marianne, there's help for you. You know, my hair follicles were still alive enough. All right. So I asked him how much the treatment was. And I made the biggest mistake that I could ever make, and I suggest that everybody out there don't make that same mistake. I didn't do it. I'm like, oh, I don't want to do this. So long story short, a year later, I'm sitting back in his office going, help me, please. Okay. And one of the things I really loved about it is, again, back to my natural lifestyle, you know, it doesn't destroy your kidneys, your liver, give you cancer, okay? It's all natural. So it's a very good treatment, and it worked. I can say this, and I can't speak for other people, but I'm extremely confident that if I had not done this, my hair wouldn't look like this today.
I mean,
And
you
it's
look
beautiful.
you have really thick hair.
Oh, thank you.
Really thick hair. I don't want to mess it up.
Oh, you can, I'm very messy. Look at it. Does
but
it look
it
neat
feels
to you?
really thick. Yeah.
So low-level laser, that's really what you're using. So as you know, Marianne said, it's not things that you're ingesting and can cause cancer or liver failure or things like that. Describe how it works.
Well, laser was actually designed in Europe in 1967 to actually heal diabetic wounds. The side effect was hair in the area being treated became stronger and healthier. Now, it can't grow hair back that's dead, but what it can do is take hair that's in the dormant or a damaged cycle and get it back to a healthy stage.
So when she said her follicles were still alive, that was an important key.
Exactly. It's no different than going to the gym, working out. You're going to get stronger and healthier. That's basically what we do with the low-level laser.
But yeah, and as we look at these pictures, you can see extraordinary results. We should say this is not Marianne, but another patient.
Correct.
But how do you know if you're a good candidate? Because a lot of people are going to say, I don't know if my hair follicle still has life in it.
The best thing to do is come in and visit with us. We actually use a microscopic camera to actually analyze the hair and the scalp. Because a lot of times scalp conditions can be a cause of hair loss. So we determine if the scalp is the issue or if it's the hair itself.
Okay.
And with that, we can determine which treatment option is the best for the individual.
Yeah.
If it's a scalp issue, we'll do scalp treatments to get the scalp back to a healthier stage.
We're out of time, but I want to
Okay.
know how many treatments it takes to get results.
Well, our program works on a year program. It's twice a week, so it is a
Okay.
commitment. But you have to follow the program in order for it to work. Again, like going to the gym, if you don't go to the gym, it's not going to work.
And you would recommend it, right?
Oh my gosh, absolutely.
Yeah.
You know, like I said, there's no way that my hair would be this healthy without it.
You look beautiful.
Thank you.
Transitions, you can visit them, go in, see if you're a good candidate. WantMoreHair.com. 1-800-GET-HAIR is the phone number. And as Marianne said, don't make the mistake of going in and saying, not now, because you'll be back sitting in that same chair a year later. You look fantastic.
Thank you
Congrats,
very
guys.
much.
Yeah.
And just
Thanks.
really quick, what does it cost for that consultation that you mentioned?
Completely free. There is
So you
no
can-
investment to come in and sit down and talk with us.
Even the scope that you use,
scope is all
you
complimentary.
can tell people if they have live hair follicles or not, and that's
Correct.
complimentary.
Correct.
Wonderful.
Great.
Great
Thanks,
to meet
you
you guys.
guys.
Thank you so
Thanks.
much.